Joining me live now, Professor Nick Talley, Editor-in-Chief of the Medical Journal of Australia. Thanks very much for your time. So what do we make of how we're seeing Delta behave, if you like, in Australia so far? Is it essentially what we'd expect from the rest of the world?
Well, unfortunately, it is. This is a deadly, serious variant of COVID-19. It really is more transmissible. There's even some evidence it may be more deadly. More hospital admissions, and that is a serious, serious issue. And the biggest problem of all is its transmissibility. So it's much easier to catch this variant of the virus, which is what seems to be happening in Sydney at the present time. And I don't blame authorities for being very, very worried based on their actions in the last days.
We've always known, obviously, COVID was, well, perhaps not always, but very early on it was could be passed on by these airborne particles. So what's different about this? Is it that people still are putting out these particles, but the virus lives longer in the air, the particles stay longer in the air? What's the reason that we know behind around transmissibility?
As far as we know, it relates to the viral load, the amount of virus in the body. And so when you breathe out or cough or produce particles or whatever, then there are more of them. And because there are more of them, that means you're more at risk of catching the virus. So with the original variant, about 2 to 3 people may catch the virus from one infected individual approximately each time someone gets infected. With this new variant, it's perhaps double that. Perhaps 5 or 6 people will catch from one person the infection. And if there's a super spreader event, even more people will catch this potentially. So it tends to occur in these little clusters, what they call super spreader events, and that seems to be a major issue for the transmission of this particular virus.
We've seen the approach from most states, essentially borderline eradication for other variants of Delta. If we do that with Delta, though, are we going to see, so many lockdowns as to make that approach unsustainable?
Well, look, I think the issue for us is how do you contain a really nasty virus like this, a really serious virus like this, effectively? If you let it run, the data says lots of people will get infected because most people are not vaccinated, a lot of people at high risk. So we will have a serious health issue if that occurs. And what's more, there are good data now that the economics are much worse if you let the virus rip. That's really clear from recent data. So the jury's really, in now. You need to, if you can, suppress transmission until the vast majority of the population are vaccinated. A vaccinated population is a different situation to deal with, and while we're still learning about how that will best work, it's really clear based on the available data, vaccination is going to be the way out. And anybody who believes that's not the case just doesn't know the data.
So that paints a bit of a bleak picture for this winter, though, of more lockdowns. At least the positive would be we emerge to summer, we know that people are outdoors more and it's harder for the virus to spread, and vaccination increases. So is there real relief on the way for Australians by the end of the year that we really will be dealing and living with COVID by then?
I'm optimistic that by the end of the year, with a much larger vaccinated population, different strategies may be able to be put in place that will avoid lockdowns and will avoid the pain that we are all feeling with the current process. But you're quite right. We are in winter. Colds are common right now. Those symptoms could be due to COVID. Not everyone's getting tested, even if they have cold symptoms. They should be, but they're not. So, the Delta variant is out there at the moment in Sydney, in Greater Sydney. Chains of transmission have not been broken. So it's bleak right now. I think we'll have more episodes too, possibly over the winter. but I'm much more optimistic about the coming towards the end of the year in terms of where we will be. Although, if a lot of people refuse to vaccinate for whatever reason, then that will leave a very large vulnerable population even then. And we know for herd immunity, it's probably got to be the vast majority to get vaccinated.